side up to prevent irritation of the patient's skin. So always wrong side up to avoid irritation of the patient's skin or rashes. So in preparation of the bed bath class or bath blanket rather, you're going to roll it this way. Reverse the longer side, the same. So look for the wide hem and the narrow hem. In this case, there's no narrow hem and wide hem. So you just measure if this cloth will cover the patient. So you look for the longer part of the bath blanket. And then after that, you start it or position it on the patient's neck. Again, check if it is wrong side. If the patient is incapable of helping you, you might as well tuck one edge to the patient's shoulders. Together with the top sheet, you're going to pull the bath blanket up to the patient's foot part. If the top sheet is still clean, you just let it hang at the edge of the foot part of the patient, at the edge of the bed, because you're going to reuse this one. If it is already soiled or wet, dirty, you will put it inside a hamper. This is because we're going to change it after we bath the patient. Next step, we have to remove the patient's gown. Turn patient to lateral position or sideline position. Raise the side doors and lock. Positioning patient for lateral position. So this one is up. The other one should be placed on the abdomen. One foot, your side straight, and on my side should be flexed. Turn patient gently, holding from the neck part or shoulder part to the buttocks. Ma'am, I'm going to turn you on the other side slowly. Okay, then remove or untie the ribbon. Sorry. Then push one side of the gown towards you so that you will pull the gown easily. Then let the patient lie back on supine position. Okay. When you remove the gown, class, you remove from the unaffected to the affected part. But in case, what do you mean by affected part? Maybe, class, the patient has fracture in one arm or wall on one hand, whole arm, or there's an IV fluid. But in what other cases, class, there is an IV fluid here, there's a blood transfusion here, there's an IV fluid here, there's a fracture here. So both arms are affected. So what is the technique? The technique, class, is remove the spike of the IV fluids, then you insert it in the patient's arm. So you're not taught that because you have no venoclisis therapy. So I'll show you it later. And then, if there's a wound or a fracture on the other arm, you have to hold it very slowly. If there's a fracture, class, it means that you don't do a necessary movement of the affected part. That's because it's very painful or you might give additional harm to the patient. You should be careful. So in this scenario, the affected arm is there and this is the unaffected. As what I've said, you first remove from the unaffected arm. And then to the affected arm. So IV bottle, you insert here because it's a big. Then after inserting the bottle here, you remove the hand or the arm, no? itong IV setup. Okay lang, I will teach you later. Oh, where's your arm, my dear? My dear patient, where are you? It's here. So we had really difficulty yesterday because the dummy was quite mutilated already. Broken bones, plenty of broken bones. Okay, always preserve the dignity. So, by the way, class, what are the three considerations that you should bear in mind with handling or taking care of patient class during procedure? One is patient's
Privacy.
safety. Two is patient's privacy. And always preserve the patient's dignity. That's why we should refrain from showing the private parts of the patient because we are observing and preserving the dignity of the patient. Of course, we have a hamper. You place it beside the hamper. So here's my hamper here. So it's already, the patient is already covered with bath blanket. Now I'm going to put one towel on top of the patient's chest to avoid soiling or wetting the linens. Another towel under the patient's head to again avoid soiling and wetting the pillowcase and the pillow by itself. Okay? Now you have poured already water. It should be lukewarm. You have to test the temperature of the water using the wrist or the inner aspect of the forearm. So I prepare the wrist. So, okay, the temperature is fine. If your patient is conscious, you might as well let the patient feel the temperature of the water. Okay. Now I'm ready. I have here 2 washcloths. Make a square meat. So there are 2 kinds of meat class. What are the 2 kinds of square meat? One is this is the square meat, which is the easiest way of making a meat. And the other one is a triangular meat. How are you going to do it? It's quite difficult when you do it. You do like that. Then, anak, ni anak. Yeah, this is the triangular meat. So most of the time, but there are already ready-made meat sold in the market. So this is a square meat. I prefer this one. So what is the purpose of a meat class? Why do you have to make a meat? To preserve the warmness of the water, to avoid mess. Imagine if you're going to hold the washcloth like this, it's messy, right? Then again, to avoid unnecessary dripping of the water. Of course, when you make a meat glass, it should be done on top of the basin. Sorry, this is my